Thank you, Deputy. I now call on Deputy Thomas Broughan on behalf of Independence for Change. You have 10 minutes, Deputy.
Thanks, Cathaoirleach. Like many other deputies, I think I was extremely disappointed and concerned to read reports last week of a planned cut of 12 million to funding for the mental health budget. I've listened to the Minister's speech and referring to the size of the mental health budget and talking about setting off one part of the health budget against another. But the reality is, as I think the previous speaker has said, that the outgoing government did preside over major cuts in this area, which it then began to restore only a few years ago. I understand the full HSE budget for mental health services. I think it's now 826 million, and an additional 35 million must be made available each year since 2011 as part of the programme for government on areas such as counselling for under-18s. And this is a critical area, I think, which the government has failed in hopelessly, as we've seen, I think, from reports and studies of mental health problems and suicide over recent days and weeks. It was to be spent on clinical programmes for adults and children with ADHD, for dual diagnosis, psychiatry and perinatal mental health services. And it was reported that that 12 million, which the Acting Minister for Health is deducting from the budget, was ring-fenced for recruitment of critical staff in this area. Of course, we know that the administration of mental health services is not just about money, and in 2014 we spent about 12%, I think, of GNI, of gross national income, on health, compared to an OECD average of 9.2%. That's, of course, including our dual health system, which we have in this country, and whose failings are so clearly visible in the reports of the huge waiting times for essential tests on the front of the Irish Times today. But taking 12 million from the additional 35 million promised to the mental health sector, it seems to represent a general treatment of those experiencing mental health difficulties. Historically, people with varying levels of mental illness and mental health problems were locked away in homes and asylums, excluded from society, and others, of course, suffered for long years in silence. Some, Cathaoirleach, still suffer in silence. There's still a huge stigma surrounding mental health in Ireland, and the optics of even considering taking back additional funding from the budget is reinforcing that historic sentiment that mental health is not a priority for government. Yet mental health is such a critical part of people's general health and well-being, and statistics show that I think 1 in 4 people will experience a mental health difficulty at some stage in their lives, and their own coping mechanisms will determine how much this will affect them during those times. The 2014 OECD study, Making Mental Health Count, the social and economic costs of neglecting mental health, of course stated that 1 in 2 of us will experience mental health disorder or illness in our lifetimes. Often in this House, Cathaoirleach, we don't live in a real world where some of the lucky ones who can afford to pay 50 to 100 euro per hour of counselling or therapy with a private practitioner, and for as many sessions as we'd like. We're not at the mercy of the public system, where you could be waiting for over 6 months for a counselling or therapy session and then granted maybe perhaps just 6 sessions. Early last year, I requested information regarding the numbers on waiting lists to access counselling and lengths of time waiting. I was informed by the HSE that at the end of February 2015, 478 people had to wait more than 3 months for counselling. And Cathaoirleach, as I think you'll agree, that's simply unacceptable, as timing can be critical when acute mental health difficulties occur. The Minister seemed to be saying, in fact, that waiting list had been cut by something like, was it 66? But I mean, it's still a huge amount of people who are waiting for, very often young people in difficulties, who are waiting for essential service. In August 2015, of course, an RTE Investigates report published a comprehensive study of suicide in Ireland. According to the report, the worst year for suicides was 2001, when the rate was 13.5 suicides per 100,000 people, and 2004 the rate was 12.2 per 100,000, and this rate hasn't been exceeded since. But of course these rates are calculated including population growth, and they do translate into real precious lives, every single one of them lost to their families, friends and communities. And 2011 of course saw a peak in the number of people taking their own lives, with 554 deaths by suicide that year. And at those who died in 2011, 83% were men, and the 45 years to 64 years cohort of males at the highest rate of suicide, while among women, the age group most likely to die by suicide was the 24 to 44-year-old cohort. But Cathaoirleach, Ireland has the 4th highest rate of suicide for those aged 15 to 19 years across 31 countries in Europe. And in front of that horrifying statistic, in 2015 there were just 54 operational child and adolescent acute inpatient beds available for 18-year-olds across the country, 20 of which were in Galway, 12 in Cork, 14 in Lindar and 8 in Fairview in this city. I think the Minister again in his earlier speech said that the number had now gone up by about a dozen or so, but unfortunately these are still very thin resources for a major issue in our health. In 2014 saw 201 admissions to community child and adolescent mental health CAMHS beds, while we know that under 18s were and are being treated in completely inappropriate adult mental health facilities. And in the PQ provided to me by the HSE this time last year, it is confirmed that the waiting list for the age-appropriate CAMHS service was 3,000 children, of whom approximately 400 were waiting in excess of 12 months. Cathaoirleach, with research showing that 75% of mental health disorders emerge before a person reaches 25 years of age, and with a high level of suicides among our young people, I think we can agree that these waiting times are totally unacceptable, and it's something that this outgoing government hasn't addressed whatsoever. Of course, the location of where people live also impacts on the statistics of suicide. So I note that RTE report, Limerick City and Cork City, showed very high rates of suicide at 16.7 per 100,000 people in Limerick and 18.5 in Cork City. We know that there are strong indications that socioeconomic factors, as previous speakers have said, play a huge role in mental illness and a person's likelihood to die by suicide. Indeed, recently Console reported that their free 24-hour helpline service has seen a huge increase in callers from people experiencing homelessness, in precarious housing situations and in mortgage arrears. And Console's helpline, I think, deals with approximately 3,400 calls per month. Unemployment and isolation are also found to contribute to a person's likelihood to die by suicide. I recently asked the Acting Minister by way of parliamentary question about his plans to increase resources to make free and affordable counselling available to those in low income in a timely manner. He replied that 7.5 million had been provided to the CIPC, the Counselling and Primary Care Service, but in some areas there were difficulties accessing accommodation in which to see clients, which in turn impacts on waiting times, and this seemed to be a major issue in rural areas. But again, it beggars belief, Minister, that those issues were not addressed over the last 5 years. Katie Quinlan, the welfare officer at University College Cork, recently wrote an open letter to Minister Leo Varadkar, Acting Minister Leo Varadkar, and succinctly said that everyone is fighting their own fight. Some of us just need more help, and that obviously refers to many of the gaps in services and the huge resources that are necessary that I've referred to above. The executive summary of the Connecting for Life strategy document states that our national conversation around suicide and self-harm is improving, and I quote, "It is essential, however, we maintain the momentum." But I think, Cathaoirleach, you'll agree that taking millions out of this area is like taking one step forward and 3 steps back, and is utterly disrespectful to those already waiting for counselling, psychotherapy, appropriate supports and clinging to hope. Like other speakers, I'd like to put on record that I'm strongly supportive, and my colleagues in Independence for Change, of the Psychiatric Nurses Association, and I note they'll be balloting their members on industrial action on May 11th as a direct result of the proposed reduction in funding. We know that according to the psychiatric nurses, there are up to 700 vacant posts and up to 1,000 nurses needed to fill current and emergency vacancies. And the answer, Cathaoirleach, to this crisis is certainly not to be cutting 12 million from the funding. So while like other speakers, I painted a grim picture here of the state of our mental health services. We are fortunate people in the public eye, such as Brezzy and the Rubber Bandits, organisations such as Pieta House and Samaritans, are keeping the public conversation going about the importance of talking about mental health. Indeed, Mental Health Reform has been conducting a very powerful online campaign, #I'mAReason, where people are outlining reasons not to reduce our mental health budget. And of course, we'll have a demonstration in support of that objective on Thursday Thursday next. It shows again, I think, of course, the absolute necessity to end this incredible interregnum. We're going on now 3 months effectively without a government, and this is one of the most urgent, critical areas of public policy we should be addressing, and still we have talking about talking and so on and so forth. I think it has to be said on the independent benches that people are getting very frustrated at this stage and reflecting the views of our constituents. We do need at least the acting minister to halt this cut.